Can migrants pay premiums for U.S. Medicaid? Have you ever wondered if migrants can pay premiums for United States Medicaid? This is an important question for many individuals navigating their health care options in a new country. Let's break down how Medicaid works and what it means for migrants. Medicaid is a government health insurance program aimed at helping low-income individuals, including some immigrants. However, it does not function like private insurance, which typically requires premium payments. Instead, Medicaid eligibility and coverage depend on factors like income, immigration status, and the specific rules of each state. For many migrants, the eligibility for Medicaid hinges on their immigration status. Undocumented immigrants are not eligible for traditional Medicaid and cannot enroll in the program. Lawfully present immigrants, such as those with green cards, may qualify but often must wait 5 years after obtaining their status before they can access Medicaid. There are exceptions for refugees, Asylees, and certain humanitarian groups who can qualify immediately. Some states have taken steps to provide Medicaid or similar coverage to immigrants, regardless of their status. This is especially true for children and pregnant women, who often receive coverage through state funds rather than federal Medicaid funds. Now, let's talk about premiums. Generally, Medicaid is designed to be affordable for low-income individuals. This means that most people who qualify for Medicaid do not pay premiums or pay very low premiums. While some states might charge small premiums or cost-sharing for certain Medicaid enrollees, this is not the norm and varies by state. For those who are lawfully present but are subject to the 5-year waiting period, there are options available. They can often purchase health insurance through the Affordable Care Act marketplaces. Here, they may pay premiums based on their income and receive subsidies to help lower costs. Additionally, many states offer Medicaid or the Children's Health Insurance Program to children and pregnant women, regardless of immigration status. This coverage often comes without premiums, ensuring that essential care is accessible. If you are a migrant or immigrant, it is important to check your immigration status to see if you qualify as a qualified non-citizen for Medicaid. Be mindful of the 5-year waiting period for many lawful permanent residents, but also look out for exceptions and state-specific programs. Explore the marketplace insurance options during any waiting periods. Investigate state programs that may provide coverage to immigrants, especially for children and pregnant individuals. Remember, if you qualify for Medicaid, any premiums you might face are usually minimal, so cost should not be a major barrier. In summary, migrants who qualify for Medicaid typically do not pay premiums or pay very low premiums. However, eligibility is closely tied to immigration status and state policies. Understanding these details can help immigrants navigate healthcare access while adjusting to life in the United States.